Well, when we think about the various factors that are having an impact on what happens to hospital services in Europe, one of the most important ones, of course, is the global recession, and very particularly the impact that is having on the amount of resource that different countries have available to fund their public services, of which health services is usually one of the most important. But in addition to financial or economic factors, there are others. For example, the population of Europe is ageing, and also many more people are living with one or more long-term conditions, so diseases such as asthma, heart disease, diabetes. And those in turn are being driven by rising levels of obesity in many of the countries in Europe. And then the other factor that's having an impact on how hospital services are organised is changing technology. So there's much more care that can now be delivered at home, or that individuals can actually give to themselves through things like the internet or using telehealth and telecare and so forth. And also, of course, we can access health services in very many different ways. So that's leading to a lot of thought about what care do we have at home, what care could we have from family doctors or in community health centres, and in turn that leads to discussion about, well, what's then the role of local hospitals and indeed larger specialist hospitals. The size of a hospital will depend on different things. For example, a country might have a different concentration of cities as opposed to very dispersed rural communities, and that will affect the sort of hospital provision they already have and how they will organise things. But perhaps most importantly now is that there's lots of concern to make sure that hospital services are of the highest quality and as safe as possible. And the view is that for very specialised services, so for example, unusual cancers or neurosurgical services, that those need to be delivered in specialist centres that concentrate on those very complex cases and diseases. So you perhaps see fewer large hospitals providing those sort of services, but then that leads to some different thinking about, well, what is it that our local or indeed community hospitals will provide? Well, we're looking at the ways in which different countries have been responding to the pressures that they face. So, for example, to economic pressures, changing technology, and the changing needs of patients. So, for example, we're exploring how in Germany the hospitals are increasingly operating in what are called chains, so looking at networks of hospitals of different sizes across the country that their health insurers are putting in place to try and make sure that the population's got the right sort of care in the right place at the right time, particularly depending on whether people are in a rural or an urban setting. Well, I think in many countries, hospital directors and boards are finding that now it can be some 40–50% or even more of their patients are elderly and are people who have a whole number of chronic diseases or long-term conditions. And so for these people, whilst it's important to be in hospital for certain specialist procedures or inputs, the majority of their care is going to take place at home or in perhaps some form of residential care or even in some sort of community hospital provision. So it's increasingly important that we have really good coordination of things such as information about patients, so joined up records across these different organisations, and really effective support in place for people and their families to help them understand how they can actually move through the different parts of their health system and make sure that they can keep as well as possible and feel really effectively supported in their care.